Okay, so today we are going to study the carpal bones. These are the carpal bones, which are 8 in number. First of all, we have scaphoid, then we have lunate, then we have triquetral, and then comes pisiform. These 4 bones constitute the first layer of the carpal bones. Then we have another layer of the carpal bones, and this comprises of trapezium. This small bone is trapezoid, capitate, and hamate. So the first carpal bone that we are going to study is scaphoid. Scaphoid literally in Greek means boat or wrist. This is the scaphoid bone, and it is called scaphoid because this is boat shaped. It has tubercle on its lateral side, and this tubercle is directed laterally, forward and downwards. This tubercle of scaphoid gives attachment to the flexor retinaculum and a few fibers of abductor pollicis brevis. The second carpal bone is lunate, and lunate is named because this is a moon-shaped bone. You can see from here, this is shaped like a moon, crescenteric shape. Lunate has 2 articular surfaces. It has to articulate with scaphoid as well as with the triquetral bone over here. For the articulation with scaphoid, it has a lunate surface, semilunar surface. And for the articulation with the triquetral bone, on the medial side of the lunate, it has a quadrilateral surface. A semilunar surface for the articulation of scaphoid and a quadrilateral surface for the articulation of triquetral. Okay, the third bone we have is triquetral. Triquetral, it gives off in its name. It has 3 surfaces, and it is shaped more like a pyramid. This is the triquetral bone, and it has 3 surfaces, 3 articular surfaces, 1, 2, and 3. These surfaces make it more of a pyramid shape. Okay. Triquetral has an oval facet. This is the oval facet of triquetral, on which rests this pisiform bone. This pisiform bone articulates with the triquetral by this oval facet. Now, the medial and the dorsal surfaces are continuous and they are not articulated with any structure. Okay, the last bone in this proximal row is this pisiform bone. Pisiform bone is P-shaped and has an oval facet on its proximal part of its dorsal surface for the articulation of triquetral bone. Lateral surface, this is the lateral surface. Lateral surface of this pisiform bone is grooved by the ulnar nerve. From here, ulnar nerve passes. Okay, so this pisiform bone gives attachment to several structures, which include the flexor retinaculum and its superficial slip, extensor retinaculum from behind, flexor carpi ulnaris, and abductor digiti minimi. By far we have studied the bones and their features of the proximal row. Proximal row contains scaphoid, lunate, triquetral, and pisiform bone. Now we are going to study the distal row of the carpal bones. These are also 4 in number. Okay. Now the first bone that we encounter in the distal row is trapezium. This is trapezium. Trapezium from the dorsal surface, trapezium from the lateral surface, from the anterior surface, and a little bit of medial. Okay. So this trapezium is so called because of its four sides. Because of its four sides, it forms a geometrical figure. That is the reason we call it trapezium. That is four-sided. Now there are some features of the trapezium which on its palmar surface it has a groove. This is the groove. The groove is limited laterally by a crest. This is the crest of trapezium. This is the crest of trapezium, and this is the groove of trapezium. The distal surface of this is the distal surface. Distal surface of the trapezium is concavo-convex. It is concave in one part and convex in the other for the articulation of the first metacarpal bone. This concavo-convex surface is also known as the sellar articular surface. This crest of the trapezium gives attachment to the muscles of the thenar eminence. Now the muscles of the thenar eminence include abductor pollicis brevis, flexor pollicis brevis, and opponens pollicis. The edge of the groove gives attachment to two layers of flexor retinaculum, and the lateral surface of this gives attachment to the lateral ligament of the wrist joint, which has to go somewhere here. Okay, now let's talk about this groove. This groove lodges the tendon of flexor carpi radialis. The second bone in the distal line of the carpal bones is trapezoid bone. Trapezoid is a baby's shoe. Just look at it. This is the trapezoid from the anterior, which you can see that it is directed dorsally and it elongates medially. From the dorsum, if we have to see, this is the trapezoid. So, the second bone in the distal row is trapezoid. Trapezoid is shaped more like a baby's shoe. This is the trapezoid from palmar surface. Now, if we trace it back, you can look it from the palmar surface as well. It has a medial projection on the dorsal surface. This is the trapezoid bone from the dorsum of the hand. Okay. Now, the distal articular surface of this trapezoid bone is bigger than the proximal surface. This distal articular surface is bigger than the proximal articular surface. And okay, so next bone in the dorsal row of the carpals is capitate. This is capitate. Capitate literally means in Latin a head. This is the rounded head of the capitate, and it also has a dorsomedial projection. This can be seen. This one. This is the dorsomedial projection. This dorsomedial projection articulates with the fourth metacarpal bone. Okay, fine. The last bone in the carpals is hamate. Hamate itself is a wedge-shaped. You can see the wedge-shaped bone. This is the posterior dorsal surface. Okay, so this is a wedge-shaped bone which has this particular hook on it, and hook is the identifying feature of this bone. So because of this hook, this bone is named as hamate, and hamate in Latin means hook. a literal hook. Okay, this hook is on the palmar surface of the bone and is directed laterally over here. Okay, so the tip of the hook of hamate gives attachment to the flexor retinaculum, and the medial side of the hook of hamate gives attachment to the flexor digiti minimi and opponens digiti minimi. So that's it. We have covered our 8 carpal bones.